Just waiting for the all clear here. Are we streaming?
Yes.
We're good? Okay. Thank you all and good afternoon. Couple of things to address today. First of all, as you might have heard yesterday, the city is working with EPCOR to defer bill payments for those experiencing hardship, and that's both businesses and households, just to be clear. More details on this initiative can be found on EPCOR's website, and this is just one of the ways the city is working to ensure that Edmontonians who need extra help are provided for. In addition to utility bills, the city continues to work out plans to provide other financial relief to business owners and residents. We're working on a solution that will give Edmontonians more time to pay their property tax bills in light of the COVID-19 related financial challenges that many folks are facing. These and any other financial aid considerations will ultimately require council approval and do have serious liquidity implications for the city of Edmonton, but we are working on it and we will keep you posted. On the story of the day, for vulnerable homeless Edmontonians, since I last briefed you, I've reached out personally and directly to the Premier, as well as spoken to a number of ministers, the Minister of Seniors and Housing, the Minister of Community and Social Services through my staff, and the Minister of Municipal Affairs directly. And while we appreciate the provincial government's continued effort to engage us on this public health crisis, delays in decision-making at the province are hindering Edmonton's ability to act swiftly and proactively to protect people experiencing homelessness and in turn protect the broader population from COVID-19. Now, under regular circumstances, our homeless population is exposed to a variety of health risks, and that is why for years I have pushed for housing as part of the solution. One of the elders who we've listened to in the past said that for members of the Indigenous community, housing is the best medicine. And never has this been more true than now. COVID-19 has exacerbated the health risks facing our homeless population: lack of stable shelter, irregular food supply, and lack of access to proper hygiene facilities, which makes them particularly vulnerable to infection. Self-isolation is almost impossible for those living on the streets, and shelters have had to reduce their capacity due to social distancing directives from Alberta's Chief Medical Officer, which of course we support completely. The virus is not beholden to any constraints. If our homeless population is not protected, the virus may spread to other communities in Edmonton and therefore represents a clear and present risk to overwhelming our emergency responders and the healthcare system. To be absolutely clear, the city and our agency partners stand ready to activate an appropriate city facility as a shelter. Police support this approach. Most of our homeless serving agencies support this approach. This option has been before the government of Alberta for several days. I want the city to take action on this, but without Alberta Health Services embedded in the activation to manage intake and public health risks, the risks of concentrating so many people in one place would be too substantial for the city to take on our own. If the province wants to take a different and more distributed approach, which seems to be what they're doing in Calgary, the city, of course, will do everything that we can to support that. But I need the province to make a decision now. Finally, never has it been more true that self-care is community care. Take care of your health and stay home if you can. Those most vulnerable to the pandemic require our collective efforts to keep each other safe. And so once again, I want to thank Edmontonians for their patience and understanding during these very trying times.
So Mayor, so obviously you're running into a bit of a brick wall. So from my understanding, there's 157 million for the feds, 60 million via FCSS. So what seems to be the problem? Funding has been announced.
So dollars are in place to support agency efforts, and this is a good thing. The challenge is the agencies need physical space to deploy their services. And to the extent that they may be working with people who need to isolate, they need places where that can happen. There is a debate between whether the existing shelters should be where people isolate and a new place should be set up for people who are healthy, or whether a new place should be set up with quarantine measures for people who need to isolate and await the results of tests. Either way, a new space or spaces is required. Today, measures were announced in Calgary where 400 hotel rooms are being activated for lower risk folks to go to who might otherwise have depended on the shelter system, so that there can be more spacing within the existing shelter system for people who have more complex needs. And more supports can be in place from the agencies who work with people. So the bottom line is additional space needs to be activated, and some of the space needs to have Alberta Health Services frontline folks there to take temperature, to triage, and to make sure that people who need to be isolated are isolated immediately. The City of Edmonton is not in a position to do that. Much as I would like to stand up a facility that would be suitable, I can't vouch for or guarantee the health of everybody working there or coming there without AHS support. I gather AHS has been working with the city to evaluate facilities and very much wants to do that work. They need the go-ahead from the government of Alberta, which I really hope we're going to get at 3:30 in the briefing.
You mentioned speaking with various ministers. I imagine you've told them of the urgency of this. What's the response you're getting when you say what you're saying now to them?
They are hearing our concern, and I think I can't speak for the government of Alberta. I encourage your colleagues to ask these questions at the 3:30 briefing. The response has been clearly the risk that I've articulated, and Calgary has shared this risk, that if the virus breaks loose in a vulnerable population, that will significantly impair our ability to flatten the curve within that population and more broadly. So everybody understands that risk, and the provincial officials, including the Premier, have echoed that they understand that risk. I believe they are trying to move as fast as the provincial government can. I understand that the question was going to come to them today or tomorrow, but I don't want to wait till the weekend to be able to activate whatever the response is, whether it's several different facilities or whether it's private hotels or whether it's a single large gathering place. I simply want a decision. And even if it's not the perfect decision, but it gets something in motion and it can iterate and evolve over time if their thinking changes, the city will respond to whatever direction the public health officials give. We simply need some clear direction to be given so that we can set plans in motion. Now, we've already done work proactively to make ready our response to support whatever that decision is, but I'm becoming increasingly concerned that the risk is only escalating as we wait for firm decision from the province.
So Mayor, aren't you a little frustrated when you hear that action seems to be happening in Calgary, and someone want to replicate that up here?
Well, that's an option and a possibility. We've been monitoring and aware of the Calgary approach, and we're prepared to implement that as well, if that's what the province determines is best from a public health evidence-based approach basis. And so, but our agencies, our police, and the City of Edmonton believe that this will all be easier to manage with a suitable large facility that can accommodate folks, and then if other things need to be added, you add from there rather than several different. But again, we're agnostic at the end of the day, as long as people are finding a better place, frankly, than City Hall atrium to go right now.
You say that there's a couple options on the table as far as facilities go, but it's kind of up to AHS to pick the right one at this point?
Well, again, the city could activate any one of a number of our facilities for temporary sheltering, but we wouldn't want to do that and create a further public health challenge by concentrating folks together without the right measures in place. So we have been, if we're hesitating, it's only because we want AHS's sign-off blessing and embedded resources to be able to manage whatever the facility or facilities might be. We've put in place a number of different possibilities for either single facility or multiple facilities. We can react to whatever they want to do.
Is a recent example, you were talking rec centers, library, what are we talking about?
Well, there's a whole bunch of different city facilities that are available, but I don't want to get into speculation about which one in particular, because I want to let the public health folks from AHS assess which facility would work best for them. I'm not the expert in determining what it's going to be, and it really should be left up to someone who's got to actually run the place and manage the public health risks within it. So the point is, we've got a huge inventory of buildings. A lot of them are dark right now because of the restrictions on gatherings. So whichever one works best, or whichever ones work best for AHS, even if they're public or private, if the province would rather work with hoteliers to do this, I am 100% fine with that. I just want a decision.
You know, you've been hearing directly from the people involved. Do their, for lack of a better term, do their excuses add up at this point, this late in the game?
I have, based on the complexity of the conversations we're having here at the city, I have great sympathy for the difficulty that provincial officials are facing in making some of these decisions. The pressure is on them because the public health calls go back to them in their jurisdiction. So I believe that they are weighing the pros and cons of very, very complex decisions that ultimately have life and death implications for people and for staff, for general public and for staff. And so I have sympathy for that. At the same time, from everything else that I have seen from other jurisdictions that are days or weeks ahead of us, the best advice is, even if you don't have perfect information, take action to reduce risk. And so that is what I have urged today, is action. And if we need to alter course in implementation, we're very happy to alter course if new information emerges that changes the way they want to deploy these kinds of services. But inaction, while it is being studied by people who are doing their very, very best, is increasing risk in my view.
Is it specifically resources you're calling for, or would the city need additional funding to get these shelters up?
I've talked about this with the city manager, and resources is a factor in this. If the city activates it unilaterally, it would be on our bill. If it's activated as a part of the broader public health response, it would be on the province's bill. But let me be crystal clear. Money is not the holdup here, because I think if we felt confident that we could manage the risk of transmission within a shelter, we would have opened a shelter yesterday. The issue is that we need AHS embedded within it, and those resources we cannot compel. Those are the provinces to deploy under the provincial state of public health emergency, and so we cannot requisition AHS to show up at a city facility to manage this risk. We have asked nicely. My understanding is they want to. They need the go-ahead from their masters.
Any indication we might get an answer to your request?
So I understand that the province wanted to make a decision on that this week. I asked for 2 days in a row. I have asked, and this morning I pled with the Premier to make a decision today.
But here we are, so you expect a decision today? I mean, we heard that the Premier's not speaking.
Well, we're going to hear from Dr. Hinshaw in 10 minutes, and it's actually her call ultimately, I understand. So we'll see what the province says later today, and my point is, the sooner they can make a decision, the better, from a public health risk management point of view, and also for the welfare of individuals whose normal places of gathering have been taken away from them, whose ability to even panhandle for resources to find food is no longer really there because there aren't people to interact with. So there is a desperate humanitarian situation starting to grow among our vulnerable population that troubles me. The associated public health risks that go along with it should concern all of us and require urgent action.
Have you been in contact with Homeward Trust and any measures they're taking in the interim?
So Homeward Trust is the flow-through agency for the federal aid and some of the provincial support. So I haven't spoken to them directly, but officials in my office and the city are working very closely with Homeward Trust to try to coordinate and optimize the best response. But I think what we're hearing back from them and from the agency folks who we've spoken to, frontline and executive director folks at the agencies, is that they're feeling overwhelmed and that they're also very frustrated at having to turn people away because of the social distancing requirements, and really have nowhere for them to turn, which is why they're in turn calling on the city to activate some kind of center, and we're in turn calling on the province to help us activate whatever capacity is missing now in the system because of social distancing requirements. And so we've certainly heard that through Homeward Trust, and they stand ready to be part of activating. Homeward Trust was instrumental in the activation of the temporary shelter at Commonwealth Rec Centre during the cold weather emergency. So they, along with the agency partners they work with, know how to do this and stand ready to do it. So.
Some dollar amounts, some sort of firm dollar amounts for funding from the feds, and what else? Can you just repeat those?
So there was a $60 million announcement from the province to fund agencies to do more work on the front lines earlier this week, and then there was also in the Prime Minister's announcement yesterday, I don't have the exact number, I think they said they were going to, for this year, double the homeless partnering dollars, which would come to an organization like Homeward Trust to then distribute to the agencies doing the frontline work. And so that's a substantial injection of liquidity to bring on extra resources and solve problems. But it's not enough for them to secure space necessarily on the scale that is necessary for the population that's at risk right now. Last homeless count was around 1,600, but I suspect that because of the economic circumstances since even the last count, that could be up, but that gives you sort of an order of magnitude to start from. The other thing that will be interesting to monitor over time is do people come to the cities for services, or do vulnerable people find their way back to home communities or other service centers as things evolve here. So I think that number is fluid, but again, it gives us a starting point of the rough need for beds.
Switching gears, we've heard that 311 is getting a huge influx of calls every time there's a developing situation in the city. Are additional resources being put to keep those channels open and available?
I'll defer that to the city manager to address. Come on over, Adam. He was interim. He's basically city manager now. So
we continue to monitor that, and similar to the transit discussion over the last few days, we want to maximize our resources for the long haul. So we're continuing to monitor, and if we're starting to see pressures, then we would take steps to adjust. But we got to keep the employee long-term health consideration to make sure that we have the resources in place for the long haul on this. So it's an ongoing thing that we're monitoring. I don't have that information here. I think certainly we can follow up later and let you know that. Thanks.
Mayor, on the hopes for a property tax deferral, you talked yesterday about the need potentially for a backstop from one of the other orders of government. Where are you with that?
So in our discussions with both the federal and provincial governments, we've been quite clear that we need to keep running, but that our main source of revenue, the property tax, is going to be difficult for people to pay, difficult for us to collect, and so making sure the liquidity that many other businesses and households are concerned about, because we have such limited revenue tools and can't technically run deficits either, we are going to need some support with that. Both within the fiscal year and potentially beyond, depending on the scale of this. So, and all of the big city mayors and the municipal associations, provincial and federal, are just beginning to wrap our heads around what the magnitude of that ask might be. But certainly the federal government has been very open to taking those measures to support other important national institutions, and so I think there'll be a conversation with both provincial and federal governments in the coming weeks about what we need. This is one of the reasons why we talk about it as the snow reserve, but the financial stabilization reserve, usually our biggest risk is how much it snows, and we dip into it a little bit in the years it snows more, and if it snows less, we put a little bit more money into it. But the reason why there's $160 million, 140 million dollars in it is also for extraordinary circumstances like this. So the city has that and other reserves we can draw from. So we're not going to bounce checks anytime soon, but we're also not likely to collect the usual $1.5 billion in property taxes that we would expect to come in June in its entirety. Therefore, we will need some assistance to move through that. We'll also be working to contain costs where we can, but we're also going to face extraordinary costs in the response to this. So it's too soon to say what the quantum will be, but safe to say we're going to need hundreds of millions of dollars at least of interim support from senior orders of government to get through this. So thanks everyone. I just want to thank Kevin Kolp and Amanda Omoth for being here as our interpreters today, and thank you all for coming into work. And if you're phoning in from remote, good for you for staying home. Thanks.